Alright, so now we're going to show everybody how we do a space maintainer on a cooperative child, a 7-year-old, right? She's 7 years old, Alyssa. She's a wonderful patient, very cooperative, and we'll make it very easy for us to do this. It only takes no more than 5 minutes to do a space maintainer using the de novo system. We extracted tooth T due to an infection. There was an abscess there on tooth T. Now we extracted when we put a space maintainer, and we will load it on tooth number 30. Using a band and loop technique with the de novo system. So by looking at this tooth, it looks like I would say it's about size number 37. If it's not exactly the same, we can always go back and get either a smaller or a bigger size. Trial and error sometimes, but sometimes you get it from the first trial. So 37, let me try 37 here. Okay, so we go and fit the band on tooth number 30. And looks like it fits perfectly fine. So we tell her we're going to give your tooth a big hug with this ring. Okay, sweetheart, do you feel the hug? Now we'll take it out. Usually it's better to use something to do with your fingers, but it's better to use a band remover if you're doing this not doing this on a daily basis like we do here. So it's size 37 and it's a wide loop. So we need, because it's so wide, sometimes they come in narrow loops. We get the wide loop right here, and when we need to cut it to make sure it fits the right distance between those two teeth. So we have a cutter here. We estimate how long is the space between the two teeth. Cut here, one cut here, and another cut on the other arm. And then we insert the loop, and this one here, that's the band that carries the arms for the space maintainer. It's a very easy, simple process. And then we push it right there. There we go. It goes in really easily, and then we can adjust the loop's length according to the space that we have here. It looks like a little short, so I will extend it a little bit to make sure it's long enough. Now it's probably long enough right now. Let me test it. You're doing great, sweetheart. We're almost done. Doing a great job. Okay, this looks like it's about the right size. So what I would do is maybe a little bit longer, just checking it. Okay, open big, sweetheart. We want to make sure it rests passively on the next tooth. Obviously we don't need to have any space. So it looks like it's right against the tooth S, which has a crown on it. So all I have to do now is crimp the arm right there. Sorry, it's a little bloody from the extraction. So we crimp the arm. This way it will be secure and it will not come off. And then we use a 3-prong plier to give it a little curve according to match the alveolus curve. So it will also allow it will not cause this loop to be dislodged gingivally because of the occlusal forces. So that's the benefit of the curve here. It will also look really nice in the mouth because it's following the curve of the gingiva. Very simple. It takes 1 second of a little bending with a 3-prong plier. And then we try it again, make sure we didn't. Sometimes when you do the 3-prong plier, it can get a little shorter, and we want to make sure it's not really, that didn't happen. It looks like it didn't happen. It looks like it's perfect. Now all we have to do is just cement it. So can you please mix cement? We use the Fuji glass ionomer cement, which is very easy, simple, and the best type of cement actually that's available because it's fluoride releasing and it's very strong. And we're putting this on a permanent molar, so we want to make sure that permanent molar, we're using the right cement that will release the fluoride to prevent decalcification under the band. So go ahead. This Fuji cement has its own tip. All you have just to push, and it will automatically mix the two liquids, and cement will come on straight to the band. Go ahead, please do that for me. Thank you. Make sure we dry the tooth. Obviously, we don't want to put it on a wet tooth, especially when it's a little bloody like this here. Can I have saliva ejector, please? And I'm gonna grab this here. Right. Give it a little rinse and dry it with some air. It's nice and clean and dry. Get a little cotton roll on the side of the cheek. Now all I have to do is just put the band there. Oh, I'm sorry, sweetheart. We're almost done there. You're doing a great job. That's it. All we have to do is just use the pusher to secure it in place. Thank you. Because it's the right size, so it's easy to push it. A little bit of pressure. We tell the patient, I'm going to do a little pressure, sweetheart. Just push, 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 okay? Push, push, push. You're doing a great job. Push, push, push. Okay? Now we use a bite stick to make sure it's sitting in the right place on the tooth. Now she's gonna help us do that. Okay, sweetie pie, say ah. Now go ahead and bite down hard, bite, open, bite down hard, open, bite down hard, open, bite down hard, open, bite hard again, perfect, excellent girl. Bite, open. Now the biting force, we need to make sure it's directed on the distal, most of the distal and the buccal actually, to make sure it's seated perfectly. Bite. And she's doing a great job. We're so lucky we have such a great, cooperative, wonderful patient here. It makes it a lot easier. Now I'm basically done with the space maintainer. I'm wiping the excess cement with a wet 2x2 gauze. You could use either cotton roll or wet cotton roll if you want, and then after you could use a dry one to make sure there's no excess cement. It looks really nice, perfect. Following the alveolus here, and we have no spaces between the band. Everything's filled with cement, so there's no risk of decalcifications around the band because everything is in perfect fit and everything is filled with cement. We sometimes use the pusher at the end to give it a little push where the groove on the buckle here to make sure it fits perfectly. It's like it's custom made basically for the tooth when you do this. Little push here, looks really nice. Give it a last final wipe, the 2x2, and we're done. You did a great job. See how fast that was? Fast and easy. Thank you very much.